Has someone you care about shown subtle but concerning changes over the past year? Many people assume that death in old age happens suddenly, but in reality, the body often gives quiet signals months or even a year in advance. Unfortunately, these signs are frequently overlooked because they may seem minor at first. It's only later, when we look back, that families realize these clues were there all along. However, by then, it's often too late to fully prepare. In this video, we'll explore 5 key signs that often appear in the year before an elderly person's life ends. Recognizing these signals early can help you offer better care, cherish meaningful moments, and ensure that your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end, as these signs can help you prepare emotionally and practically for what's ahead. When you understand what's happening, you won't be caught off guard and can make the most of your remaining time with those you love. Let's get started. One of the earliest and most telling signs that an elderly person might be approaching the final year of life is unintentional weight loss. Initially, it may seem subtle. Perhaps their clothes are suddenly looser, their belt feels too tight, or they no longer seem as hungry as they once did. Many families dismiss this as a natural part of aging, but it's important to recognize that significant weight loss is rarely a good sign. It often indicates that the body is no longer absorbing nutrients effectively. As muscle mass decreases and vital systems slow down, the body struggles to digest food or process protein properly, leading to muscle wasting. This can make movement harder, increase the risk of falls, and weaken the immune system, leaving the person vulnerable to infections. Weight loss can also be a result of appetite changes. Many elderly individuals no longer feel hungry the way they used to. Their sense of taste fades, food loses its appeal, and they may start skipping meals or eating much smaller portions. This isn't just about preference. It's a physiological change. As the body begins to shut down, it no longer signals the brain to seek food as often. The result is less energy, strength, and a gradual decline in overall health. Medical conditions like cancer, heart failure, or kidney disease can contribute to this process, as well as conditions like depression or cognitive decline that reduce appetite. Families may try to encourage their loved ones to eat more, offering favorite foods or supplements, but if weight continues to drop despite these efforts, it's crucial to recognize that the issue isn't just about diet. It's the body preparing for a deeper transition. At this point, focusing on comfort and hydration, rather than large meals, can make a bigger difference in maintaining quality of life. Another noticeable change in the year leading up to the end of life is profound, persistent fatigue that doesn't go away with rest. It's more than just feeling tired after a long day. It's a deep exhaustion that makes even simple tasks feel overwhelming. Getting out of bed becomes a challenge. Walking across the room feels like a struggle. And activities that were once routine, like cooking, dressing, or holding a conversation, become draining. This exhaustion isn't just a result of aging. It's a sign that the body is conserving its remaining energy. As organ function begins to slow, the body starts prioritizing what's most essential. The heart doesn't pump as efficiently, circulation weakens, and muscles don't get the oxygen they once did. Metabolic slowdown is another factor contributing to this fatigue. The body's energy, once used for movement, is now directed toward preservation. This leads to longer naps, more sleep, and sudden drops in energy, where someone might seem fine one moment but completely drained the next. What can be particularly heartbreaking is the emotional impact of this fatigue. Seniors who once took pride in their independence may feel frustrated or even embarrassed that they can no longer do what they used to. This can lead to withdrawal from social interactions and hobbies, accelerating the physical decline. It's easy to mistake this as laziness or a lack of willpower, but forcing activity will not help. What's most important is recognizing their limits, allowing them to rest when needed, and making their remaining days as comfortable as possible. If you notice deep, ongoing fatigue that isn't relieved by rest, it's a sign that their body is undergoing a significant transition. As a person nears the end of life, you may notice changes in their cognitive function. They may forget things more often, struggle to follow conversations, or become disoriented in familiar places. They might repeat themselves, forget names, or lose track of time. These changes are subtle at first, but can happen months or even a year before death. This is not just everyday forgetfulness. It's a sign of cognitive decline, as the brain receives less oxygen and nutrients. This can lead to confusion, difficulty making decisions, or struggling to recognize familiar faces. Emotional withdrawal is also common. Seniors may lose interest in socializing, speaking less, or sitting in silence for long periods. It's not that they don't care about their loved ones, but their brain no longer processes emotions and engagement the way it used to. They may also show changes in mood, becoming more irritable, anxious, or even unusually calm and detached. For family members, this stage can be particularly difficult. It can feel as though you're losing them before they're actually gone, but it's important to remember that they can't control these changes. The best thing you can do is meet them where they are, speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. Frequent infections and slow healing are also signs that the body is winding down. Someone who rarely got sick before might suddenly seem to catch every cold or flu that comes around. Small illnesses take longer to recover from, and even minor cuts or bruises heal more slowly. This is because the body's ability to defend and repair itself diminishes. Repeated infections such as pneumonia, urinary tract infections, or skin infections become more common, and antibiotics may no longer be as effective. Chronic wounds, especially for those who are less mobile, can also signal that circulation is compromised. Poor blood flow means that oxygen and nutrients aren't reaching the skin and tissues efficiently, making healing much slower. Infections in the final stages of life don't always present with the usual symptoms, like a high fever. Instead, the person may appear more tired, confused, or less interested in eating. Recognizing these subtle changes early can help ensure they receive the proper care and comfort during their final days. Lastly, significant changes in breathing patterns or circulation often mark the body's final stages. Breathing may become slower or more shallow, with pauses between breaths. Some people experience a rhythmic pattern of breathing known as Cheyne-Stokes respiration, where the breathing alternates between deep, rapid breaths and long pauses. Circulation may also weaken, causing extremities like hands and feet to feel cold, and the skin may appear pale or bluish. These changes can be distressing to witness, but it's important to recognize them as part of the body's natural slowing down process. There may not be a way to reverse these changes, but there are ways to make them more comfortable, such as offering small sips of water, adjusting the room temperature, or using medications to alleviate discomfort. As difficult as these signs may be to accept, it's essential to recognize them for what they are, indicators that the body is preparing for its final transition. Instead of focusing on trying to reverse these changes, we can focus on providing comfort and ensuring that our loved ones feel safe, loved, and understood. In these final moments, what matters most is the quality of the time spent together, filled with love, dignity, and peace. Unintentional weight loss in elderly individuals is one of the most telling signs that the body is in a state of decline, especially as they approach the final year of life. Initially, weight loss might seem subtle, with small changes that could easily be overlooked. A belt that suddenly needs tightening, clothes that fit more loosely, or the person feeling less inclined to eat are common signs that might be dismissed as part of normal aging. However, when weight loss occurs unexpectedly and without any intentional effort, it often signals something deeper happening within the body. In many cases, weight loss in older adults is not just about appearance. It reflects a deeper, more concerning issue related to how the body functions on a physiological level. As people age, their metabolism naturally slows down, and muscle mass begins to decrease. This is a normal part of aging, but when it happens too quickly or unexpectedly, it's indicative of something more serious. The body's ability to process food, absorb nutrients, and use energy diminishes, leading to a gradual breakdown of muscle tissue, which ultimately causes weight loss. Muscle loss, often referred to as sarcopenia in aging adults, is a condition in which the body loses muscle mass and strength over time. As muscles decrease in size and strength, daily activities become harder and the body becomes more fragile and vulnerable to injuries. This decrease in muscle mass is often coupled with a loss of strength, which not only makes movement more difficult, but also puts individuals at a higher risk for falls and fractures. The loss of muscle tissue further exacerbates the decline in an elderly person's overall physical state, affecting their balance and mobility. One of the reasons for rapid weight loss is the body's struggle to absorb nutrients efficiently. As the digestive system ages, it may become less efficient at breaking down and absorbing food. The intestines may lose some of their ability to absorb essential nutrients, such as proteins, vitamins, and minerals, which are crucial for maintaining muscle mass and overall health. When this happens, the body doesn't get the fuel it needs to sustain itself, which accelerates muscle wasting and contributes to weight loss. In addition to poor absorption of nutrients, some elderly individuals might no longer be able to process food properly due to a variety of underlying health conditions. For example, diseases such as cancer, heart failure, or kidney disease can lead to weight loss long before more obvious symptoms appear. Chronic conditions like these place a significant strain on the body and its ability to function. Cancer, for instance, causes a metabolic imbalance in the body, resulting in the breakdown of muscle tissue and the loss of fat, often leading to extreme weight loss. Similarly, heart failure and kidney disease can impact the body's ability to retain fluid and essential nutrients, which can result in unintentional weight loss as well. Aside from physical causes, changes in appetite are also a significant contributor to weight loss in the elderly. Many older adults simply don't feel as hungry as they used to, and food may no longer appeal to them. This change is due to both physiological and psychological factors. As the body ages, the senses of taste and smell become less acute, making food less enjoyable. Additionally, the body's natural hunger cues may not signal the brain as effectively as before, leading to a diminished appetite. For many, the enjoyment of eating diminishes as the years go by, leading to skipped meals, smaller portions, and eventually a significant loss of weight. In some cases, mental health issues such as depression or cognitive decline can also contribute to a loss of appetite and weight. Depression, which is not uncommon in the elderly, can make individuals lose interest in food, causing them to eat less. Likewise, cognitive impairments like dementia may interfere with their ability to remember to eat or recognize the need for nourishment, which further contributes to the decline in weight and overall health. At times, families may try to solve the problem by encouraging their loved ones to eat more. Offering favorite foods or supplementing meals with high-calorie protein drinks are common approaches. While these efforts are well-meaning, they may not always be effective, especially if the underlying issue is not simply a matter of poor appetite or a lack of nutrition. If weight continues to drop despite these interventions, it's important to understand that the body is signaling a deeper transition. The aging process, combined with underlying medical issues, is impacting the person's ability to process food and absorb nutrients properly. It's also essential to recognize that at this stage, the focus should not necessarily be on force-feeding or pushing for large meals. Instead, the goal should be to provide comfort, support, and easy-to-eat foods that won't cause unnecessary stress. Nutrient-dense options like smoothies, small meals, or liquid supplements might be easier for the individual to consume. Hydration is equally important, as dehydration can exacerbate feelings of weakness and discomfort. The priority should be comfort and quality of life, not simply trying to reverse the weight loss. Understanding the nature of the body's decline and accepting that this process is a natural part of aging can help families cope and provide the necessary support for their loved one during this challenging time. Ultimately, significant weight loss in elderly individuals is a clear indication that the body is struggling to maintain balance. It's a sign that vital systems are slowing down and that the person's physical state is declining. Recognizing this early can help family members and caregivers provide the necessary care and create a more compassionate environment in which the individual can maintain their dignity and comfort as they enter the final stages of life. In conclusion, understanding the subtle signs that an elderly person may be approaching the final stages of life is crucial for both preparing emotionally and providing the best possible care. These signs, such as significant weight loss, extreme fatigue, cognitive confusion, frequent infections, and changes in breathing patterns, can help guide families in making informed decisions about care and ensuring that the final months or years are filled with comfort, dignity, and love. By recognizing these changes early, families can offer their loved ones the support they need, cherish the remaining moments together, and create a peaceful, safe environment during this challenging time. Thank you for taking the time to watch and engage with this important information. I hope it has been helpful in guiding you through what can be a difficult and emotional journey. Remember, understanding and compassion are key to making these moments meaningful. Wishing you strength and comfort as you care for your loved ones. Good luck, and thank you for your support.